One of the things that we recognize is that we really are in a defining moment in the fight against heart disease and stroke. There's no question that we have made remarkable progress over the past many decades in fighting heart disease and stroke. As a matter of fact, the 82.6 million people who are alive today who have suffered some sort of cardiovascular disease are a real testament to the work that we've done as an organization and with our partners in communities throughout this country. And the fact that cardiovascular disease death rates have declined for the past 40 years is very, very significant. So we know we've accomplished much in the last century, but we have so much more to accomplish as we move forward because the landscape around us is clearly changing. We know that the devastation from cardiovascular disease and stroke is actually on the increase when we look at the global picture of heart disease, and the impact of that, both in terms of lives lost and dollars to our economies, is so very, very significant. The future also holds a greater promise than ever to fight cardiovascular disease and stroke. One of the things we pride ourselves on in our organization is that we're a science-based organization, and everything we do is based on scientific evidence. And I would say that we're at an all-time high of understanding new treatments, new therapies, new procedures that can help people prevent their risk of cardiovascular disease and help people who have suffered some sort of event. And so the possibilities before us to change lives and save lives is significant, and our impact on public health can be absolutely incredible. And that's why we set the most bold goal that our organization has ever set, our 2020 Strategic Impact Goal, to improve the cardiovascular health of all Americans by 20% while reducing deaths from cardiovascular diseases and stroke by 20% by the year 2020. And we know to achieve this goal, as I've said many, many times before, we are going to have to be different and we're going to have to work different to make that impact. Because one simple thing is true, even though deaths from cardiovascular diseases have declined, even though science for cardiovascular disease and stroke prevention and treatment has never been better, we need to find a way to get people to care about their health. We need to be aggressive in working to change the systems that people are treated in and the communities in which they live in order to give people a chance to have better health and a better life. And so how do we at the American Heart Association create a response to this need for people to care about their health, to change communities, and how do we build upon the things that we've done that have made this organization such a success for so many decades? We need to think through how we allocate our precious resources to have the greatest impact, how we can aggressively raise more money to invest in the things that will make a difference. We need to think in new ways, and we need to build on the fact that we have been leaders, perhaps even visionary, in the way that we've run this organization over the past many years. We were visionary when we changed our mission statement in 2007 to focus on improving health instead of reducing death. We've been visionary when we defined cardiovascular health and set our 2020 Strategic Impact Goal. We've been visionary when we've created a global strategic plan for the organization. And we've been visionary as we've set bold fundraising goals, even in the light of challenging economic times. And so when I think about all of this, I have such great hope for the future of our organization and collectively how all of us as employees who impact volunteers and communities can make a real difference in our work moving forward.